Hello everyone, welcome back to my channel. In this video, we are going to see the benefits of intermittent fasting for our oral health. Okay, let's start. So, what is intermittent fasting? It's a popular dieting method that doesn't restrict what you eat. Instead, it focuses on when you eat. So, you consume your meals within a specific intervals of time to limit the intake of calories. This eating pattern cycles between periods of eating and fasting. It's beneficial for weight loss and overall health. It reduces inflammation in the body and it improves oral health. But it's important to mention that intermittent fasting is not for everyone. Certain medications and chronic health conditions may not be compatible with intermittent fasting. For diabetic patients, there is a risk for hypoglycemia. So make sure you talk with your doctor before making any drastic dietary changes. Okay? Now, let's take a closer look at the changes that happen inside our bodies during eating and fasting periods. The period when we eat is called the fed stage. In the first few hours after a meal, our blood sugar level increases and the hormone insulin is secreted. Insulin is important for transporting blood glucose into our cells. Of course, the amount of insulin secreted depends on the amount of carbohydrates we consume. Okay. The extra glucose, which is not used for energy, gets stored in liver and muscles as glycogen. Now, around 3 to 4 hours after eating, our blood sugar and insulin levels start to decline. Now, instead of insulin, another hormone called glucagon comes into action. It converts glycogen back into glucose, providing energy. This process is called glycogenolysis. But after 8 to 12 hours of eating, glycogen levels will get depleted. What happens when our glycogen levels are depleted? At that time, our bodies enter a fasting stage where we start burning fat for energy. That's called ketosis. Ketosis produces ketone bodies which become the primary source of our energy. Have you ever wondered why we don't feel hungry when we wake up in the morning, even though we haven't eaten anything for the past 8 hours of sleep? But as the day goes on, we start feeling hungry again, even after eating. It's because our bodies go through a semi fasting stage each night. During this time, our energy supply comes from the fat, not from the glucose from our meals. It's interesting, right? Okay, I want to mention about ketoacidosis is different from ketosis. Ketoacidosis happens when our blood becomes too acidic. It typically happens due to infection, illness, or unmanaged diabetes. Okay, now let's look at the amazing benefits of intermittent fasting for our oral health. Number one benefit is there will be reduced plaque buildup. Plaque is the sticky film of bacteria that accumulates on our teeth. When we eat and drink throughout the day, sugar comes into contact with the teeth and gums regularly. It causes plaque formation. Plaque leads to tooth decay, cavities, and gum diseases. But with intermittent fasting, mouth is limited to just a few hours of potential damage, significantly reducing the formation of plaque. Okay? Another benefit is intermittent fasting regulates the pH of saliva. Saliva plays an important role inside the oral cavity. It kills harmful bacteria and neutralizes acidic environment inside the mouth. So it's really important for the pH levels to be regulated. Some foods can actually make the saliva acidic, causing acidic saliva related problems like cavities, bad breath, or dry mouth. So, not eating for a certain period of time can actually neutralize the pH of saliva. Okay? Another amazing benefit of fasting is it can reduce the inflammation in the oral cavity, leading to a decrease in gum diseases. Also, during fasting, our bodies undergo a process called cellular cleaning. During cellular cleaning, damaged cells in our bodies are broken down and eliminated. So, of course, there will be improvement in oral health. Okay? Now, I want to share some dental tips to remember if you follow intermittent fasting. First of all, maintain a well-balanced diet because that will prevent the nutritional deficiencies inside your mouth. Okay. Also, make sure to include lots of fiber-rich veggies and fruits because they will help in remineralization of teeth. Staying hydrated is a key as it helps in saliva production. And as always, maintain good oral hygiene by brushing twice a day, flossing, gargling with warm salt water, and use mouthwash if necessary. And please don't forget to schedule those frequent dental visits for a healthy smile. That's all for today's video. Thank you so much for watching. Take care.